Good morning, and thank you for joining us for an intimate community conversation, cultivating a beloved community. Our session today will feature Dr. Estelle Williams, Mr. Dante Moorhead, and Randy Ford as our panelists for this first of several community dialogues we will have in this important program, the Public Art and Community Dialogue Program. We begin with this land acknowledgement. We acknowledge that the Fred Hutchinson Cancer Research Center sits on the traditional land of the first people of Seattle, the Duwamish people past and present, and honor with gratitude the land itself and the Duwamish tribe. Our statement in affirmation of Black lives reads, Fred Hutchinson Cancer Research Center is committed to becoming an anti-racist institution. In this endeavor, we are determined to strengthen and deepen our efforts that affirm the equal rights, value, and protection of Black people in the streets, on our campus, and in our science. To that end, we will identify any policy, practice, or behavior at the Hutch that reflects anti-Black racism and dismantle them, holding ourselves accountable in these efforts. Black lives must matter in our science, our recruitment, our institutional climate, and our influence. Again, thank you for joining us this morning. I am Paul Buckley, Vice President and Chief Diversity and Inclusion Officer at Fred Hutch. As an overview of this exciting program that we have launched, the Public Art and Community Dialogue Program, on behalf of the Office of Diversity, Equity, and Inclusion, I want to name to you why we have undertaken this particular effort. One of the critical ideas to this program's initiation is that systems of oppression depend on the public losing interest in movements, driving transformative change. And so we want to sustain the interest in our communities having a sense of equity and inclusion in the efforts of the Hutch, and for us to continue to develop and deepen the relationships that we have with particular communities. So right now we are having a particular focus on the Black community, and then we will engage the Indigenous community, the Asian community, the Hispanic or Latinx community, the Pride community, and the Jewish community. As an extension of our efforts to drive transformative change in our organization and greater community, Fred Hutch is taking this authentic, affirming, and active approach to sharing the message that Black, Indigenous, and all people of color and other minoritized and underrepresented people matter to us in our science, our community, and beyond. So the Public Art and Community Dialogue Program will engage our communities in a series of dialogues and celebrations to showcase the artwork of diverse artists within our community across our South Lake Union campus and in our programming activities. The program will also provide an opportunity for the selected artists to connect, explore, or align with each other, and representatives from Fred Hutch to inform their final commissioned work and future community initiatives. The arts installations that will be produced will serve to replace the current Black Lives Matter banner and flag, engage other underrepresented communities, and create broader messages of solidarity that affirm the Black community and its connection to other communities in our broader community of Seattle and this region. The dialogue program is one aspect of this entire program. It provides an opportunity for employees and the broader community to be in dialogue about what community solidarity means and what does the pursuit of equity in research and healthcare mean to these distinct communities that also connect and integrate with other communities. We will foster ongoing dialogues across these communities and allow these dialogues to inform how we represent solidarity in visual form. Dialogue is an opportunity to share lived experiences, reflections, history, culture, and aspirations for holistic and sustained health in the Black community. So our discussion today will further deepen Fred Hutch's commitment and connection to community, internal and external, toward this movement of greater justice in healthcare, in research, and in our living experience. So before I introduce our panelists, I just want to offer a special thank you to members of our committees in this public art and community dialogue program. They are listed on your screen. Thank you so much, Natalie Curtis, John Masembe, Nikita McPherson, and Dante Moorhead, who's also a panelist today, for your work on the Art Selection Committee. And much of the work is ahead of us, but we're looking forward to all the work that will be done. And for the Indigenous and Native American Artist Selection Committee members, Craig D., Twyla Gleason, Lenora Starr, thank you so much for the work that you've begun to contribute and all the time and effort that you'll contribute in the over the duration of this program. So now let me introduce our panelists. And I will start with introducing Dr. Estelle Williams. Estelle Jamila Williams is a medical doctor, was born and raised in Oakland, California. The youngest of 7 siblings, raised by a single father, and the first in her family to attend college. After attending Xavier University in Louisiana, a historically Black college and university, she was ultimately displaced by Hurricane Katrina and transferred to the University of San Francisco, where she ultimately graduated college. She spent 2 years in healthcare workforce diversification, working as a program coordinator for mentoring in medicine and science, Incorporated, and a project manager for the Alameda County Health Careers Consortium. She went on to attend medical school and residency training in general surgery at the University of Washington. And we're grateful that she went there, which I think ultimately leads her to be here with us today. She is now an assistant professor of surgery in the School of Medicine and an acute care surgeon in the Department of Surgery, section of Emergency General Surgery. Within the School of Medicine, she is executive director for Doctor for a Day, an outreach program introducing under-resourced K-12 students to health careers. Additionally, she serves as a physician-at-large member of the Washington State Medical Association Foundation Board, working to advance efforts around healthcare equity. Her passions, of course, include health justice, healthcare disparities, health outcomes, healthcare workforce, diversity, the ecosystem programming to increase the number of students traditionally underrepresented in medicine and healthcare careers, and more. In response to the 2020 Black Lives Matter uprising, he organized a march of 10,000 healthcare workers from across the state to declare racism as a public health emergency. In her free time, she has that, she enjoys spending time with her family, including her husband, 4-year-old daughter, and now 5-month-old son. She also co-founded, along with her husband, Estellita's Social Justice Library, a community library and bookstore focused on uplifting voices of communities of color, named after their daughter, Estella. Welcome, Dr. Williams. Then let me now introduce Dante Moorhead. Dante Moorhead, who has a master's in public health, is the community health educator for African American or African descent populations here with the Office of Community Outreach and Engagement. His work focuses on outreach, engagement, education, and community-based participatory research with communities in the Washington catchment area. He works with patients, researchers, physicians, community advocates, and community-based organizations to address systemic inequities in the context, systemic inequities in cancer prevention and care. His own personal journey with health and his survivorship in the context of his identity as a Black or African American male influences his passion for health equity, social justice, public health, community outreach, and public health research. Welcome, Dante, and thank you for being with us. I want to note that in advertising this program, we intended to have 3 panelists, but unfortunately, the 3rd panelist is not joining us at this time. So that adds to the pressure for Estelle and Dante to come through with the conversation this morning. Thank you all. So we are talking about building this beloved community. And I want to start by asking you both, what does community mean to you? And how are you engaged in community?
I'll get started.
Thank you.
I think that is a wonderful conversation to, begin this dialogue with. I first want to say thank you so much to the entire committee for the invitation to be a panelist and for the wonderful introduction, Dr. Buckley. To jump right in, community can mean so many different things to many people, which is why I think these dialogues carry so much importance, because it can inform the way in which we engage with each other, because of our particular lived experience will definitely frame the way in which we see and engage with the community around us. I think that of my own roots growing up in Oakland, where the Black Panther Party was founded, community has been ingrained to me to include all of those who share your similar struggle. And that is regardless of race or ethnicity, because you have a deeper understanding of the material conditions of those who are in close proximity to you, which is often along socioeconomic lines. You're sort of in the same boat almost, right? Like you're all fighting the same struggle. So how do we unite along that same, along those struggles in order to advance our common goal or our common cause? So for me, community has included not just those who are represent my same racial ethnic background as a black female in the United States, or as a black person descendant of slaves, but really all of those who share that common struggle, which included, everything from my Tongan and Cambodian neighbors to my Mexican speaking neighbors to, all of those who, shared the same material circumstances growing up in East Oakland, just trying to survive. And I think that has extended even to, being welcomed here in this Seattle community, recognizing that shared experience of gentrification, of being pushed out of communities that you enriched or built up or made, something that other communities gravitated to or wanted to be present in, that ultimately resulted in the uprooting of so many of those cultural spaces and communities that meant so much to, especially the Seattle Black community. And I think being in community for me then meant, recognizing how that happened even in my own hometown of Oakland, coming here to Seattle, and how do I then, advance or help this community, because, our stories are similar, even though the geographic locations are different, the stories, the experiences are similar. And how do I then, as a Black person coming into Seattle, where gentrification has happened and Black communities have been pushed out, how do I advance the cause here to help the Black community here, and engage with it as if it is my own, because they have welcomed me and allowed me to be present here in this space. And how do I uplift the voices of those who historically have been displaced? And so that to me is how I approach community, is that we have a common struggle, a common goal, and how could we continue to advance and uplift each other? Because my saying always includes that, we shouldn't fight for crumbs off the table when there's enough for everybody to take a slice of the pie.
Thank you so much, Estelle. Dante, lean in.
Sure, and I'm glad to be here. Thank you for having me, and as well, nice to meet you, Dr. Williams. Yeah, and so going off what she said, I agree. I believe what it means to be in community is the lived experiences or similar struggles that you share with people of like minds, and you can take that with you wherever you go. It's a part of you. I'm one of the people who believe that, for example, trauma can be passed on historically or genetically. And if you can find that solidarity, it can be, cultural sharing or mentality or even attitude that you have, you ultimately share a perspective with others and the world. And as far as engagement and engaging, it's an everyday thing. Like, I don't stop being Black whenever I go to bed, and it doesn't reset. I'm Black 24/7. And so I consider myself a representative, excuse me, of that community, and want to constantly engage with them and find more things in common. We all want that seat at the table, as she mentioned, and sometimes if we end up fighting for crumbs, then maybe we should consider creating our own. I'm not saying that it'd be better or anything like that. It would just be different. And in the context of, for example, I moved here from North Carolina. It's totally a change of pace. I'm a country boy / city boy from Chicago. And so I wanted to connect with the new community out here, and come to find out, whether you are Black in North Carolina or Black in Seattle, you may find some of the same struggles. And so when you look at engagement, it's kind of engaging with each other, never forgetting those struggles, or connecting with people of like minds who share those struggles. And one of the things that I work on when it comes to engagement, for example, is in health equity and cancer care. And when it comes to those cancer and health outcomes, we do see that our people have disparate outcomes. And so to be a part of the community means to acknowledge that, and to also be aware of it, but to try to make moves to change that, and to get representation, and to fight for more than just crumbs off of the table. So to me, community means sharing your lived experiences and similar struggles with other people of like minds. And Dr. Williams touched on a lot of great points, and I certainly would echo that.
So let's stay with this metaphor of, the
Mhm.
crumbs on the table. I want to talk about the table. So what is table making? What does table making looked like for you over the past 2 years? As someone who's a transplant to this community,
Mhm.
I got here
Mhm.
a few weeks before pandemic and, remote living, if you will. Um, what does table making look like in the era of COVID?
Sure. So for one, we noticed that obviously your race, culture, ethnicity can have an effect on your health outcomes. And so when we saw COVID come around, that did a lot to highlight that disparity that already existed. We all knew it already, but when you see the numbers, the incidents, the cases, you can see that people from Black and brown populations in certain areas were affected even worse, and it's just a shining example of things that exist in other avenues of care and medicine. And so when I say creating that table, what we mean is there are a lot of spaces where we don't necessarily have a large platform or a voice, in which case we would have to, and when we do, we are given a very small seat at the table. There's not a lot of leadership power necessarily. It's not things like that. So in the context of COVID and working remotely, now that we have the world's attention, it would be a time to let everybody know that perhaps you can look at what we're doing and do things our way. You don't want to listen to us. And of course, there was this whole 2 years of we're going to listen. We're listening. And so at what point does listening become actionable items? So we're interested in transformative change. So creating our own table means creating spaces to where you can come to us and listen to what we have to say and what we have to talk about. And so over the course of those 2 years, that's some of the things that I did. I found those like-minded individuals who wanted to make noise, who wanted to be leaders in the community, who wanted to get their issues addressed, and we did our own thing. Or you connected with people who wanted to create bigger platforms, who wanted to create your own space, and then invite other people to that space. And so that's something that we did. And you saw the numbers with COVID. We were affected at almost 3 times the rate as other counterpoints in some areas of the country. And so when it's harder to do from a virtual platform, but yet at the same time it's easy. And let me share what that means. So in public health, we had to pivot to a more virtual platform. Great. So we're online now. There's tons. Everybody's on the internet. Internet connects people globally, and there are a whole lot of causes and important messages out there that you can gather to or relate to, and that doesn't do anything but increase the platform and uplift those voices. And so that is something that I would say when we're talking about creating our own space, our own tables, and then bringing in powerful voices, voices like, Dr. Williams, your bio was super long and super impressive. I've Googled you before at UW. I'm a fan of UW. And so you have these people who have these platforms. It's bringing these platforms together and creating a big space to amplify those voices, but not only the voices, but the work that leaders are doing in this space. We talk about a lot of health equity tourism, for example. I always knew health equity was a thing, but, recently, as of the past 2 years, we see a lot of health equity tourists who are, and I'm not saying they don't mean well, but I'm saying there's a lot of people who have co-opted that work when there were already voices trying to do that work. And so, some of it is not always creating a table, but taking our space back in that table. And so for me, that's what I look at when I'm looking at those spaces and creating those tables. And engaging with patients and community is also important. I think there's a lot of value and perspective that it's an untapped resource that we need to utilize more when it comes to community engagement. There's a lot of power in that. And I think if we tap into those spaces more, we'll be able to make some transformative change, especially when it comes to the Black community. But there has to be that level of trust first. And so that's what we are trying to work on.
I love it. I think that everything Dante said was amazing and hit the nail on the head. I think, it the if healthcare already had the answer, if getting the highest scores on these standardized tests and getting the most intelligent people in the room was the answer, then we wouldn't have health inequities that are continuing to, the gaps that are continuing to widen today. So those aren't the answers. We have communities that have been suffering at the hands of injustice from the healthcare system since the creation of our healthcare system, right? And yet they have sustained and continue to create resources within themselves to help support each other. And even with that, they're doing that without getting the big grants from the NGOs, right? And so the answers to how a community wants to address their problems are already with them. We just don't take the time to listen. And I think that's where these dialogues are so important, because you have to bring in those voices who are oftentimes disregarded because they don't have the degrees or they don't have the job titles. And so thus they are not felt to be able to engage with or actually contribute to this conversation when they're the ones who are directly impacted. If anything, they're the ones who have the answers to begin with. So what I've loved seeing within the pandemic and what has occurred out of the pandemic is that there are all of these grassroots organizations that have said, we're no longer waiting. We need to address these needs within our communities ourselves. And that's what building or creating a table in the pandemic looks like. You have things like the Tubman Center, that is grassroots, that came out of, the will of the people, and they're now creating resources, bringing vaccines into the community, finding ways to partner, making for sure that they're actually bringing resources without waiting for big health institutions to recognize the importance and develop the bureaucracy that will allow them to go and engage within the community, right? And you have things like King County now and their health equity team. They are the ones who are creating so much space, taking up space, not apologizing, not using dialogue that makes white people feel comfortable, but just saying, we are the ones who have been suffering injustice. This isn't about your comfort. This is about our people and the survival of our people. How do we get to that point? When you look at Africatown and what it's doing with trying to address things like economic injustice, recognizing that when you talk about social determinants of health, the interconnectedness, health doesn't stop when you leave the clinic or the hospital, right? It is the communities that people go back to. It is the food insecurity. It is the environmental injustice when they have to go back to communities that are in industrial neighborhoods and they have higher asthma rates, like the paper that was just published, right? So you have all of these things. And then you have individuals like Dr. Margaret Tawawi, who started her own primary care, direct access primary care clinic, and the first Black woman to open her own practice. When you hear about all the private practices that are shutting down and private practice is a dying thing and we're not doing that anymore, you have a Black woman who says, I'm bringing direct patient care to our community and making sure they have access to care and quality care instead of being absorbed and not listened to, right? And so that's what we call building a table. It's not waiting for other communities to either value us, bring us grants that we oftentimes never get because we don't have the huge capital or the big names that are going to lure big grants, big donations. It is, we have been able to sustain ourselves despite the lack of investment, and we're going to continue to do so. And we're going to do so in a way that is going to uplift our people without having to answer questions or explain our being to organizations and communities and institutions that will then question us when we're the ones who have that lived experience in the first place.
Thank you both very much. One of the things that I want to bring into this conversation sooner than later is when we say Black community, how diverse that community is, right? And the intersections of race with other dimensions of diversity or other dimensions of identity that's still Black community. And I want to invite you just to share from your perspectives how you think about this diverse but one, intersecting but not fragmented community that is Black community.
Dante, I'll let you start.
Sure. So I think about it as the whole diaspora of the African community. Some people like to make the determination or the distinction between, Africans and African Americans, and that's also true. There are some distinctions. So I look at it as, you all often hear the term, we are not a monolith or things like that, and we are not. And it's important to recognize that even though we are not, we do have some similar lived experience, especially one thing you'll notice that in this country specifically, it's a totally different ballgame versus in other countries, how people of color are treated or how we act. And so that experience in this country is what binds us, but we also have to be aware of the fact that not everybody has roots in Virginia, Seattle, whatever. They're from abroad. They're from our ancestral homes. And so we look at that and we say, okay, we are diverse, but yet what makes us similar in this country is that we are minorities still. And so that is something that I recognize. And I also recognize it from cultural aspects. I work with a lot of African and African American communities. And there's a cultural thing, with a lot of, for example, Somali or Ethiopian versus African Americans. There's a different set of issues, a different set of cultural things that we need to take into account. And so I juxtapose that with, when it comes to health equity, that doesn't matter because they're still being treated with and having worse outcomes. And so that is something that can bind us. And the fact that we just spoke about, for example, creating tables, well, regardless, we're all still looking for that table to get those crumbs or to create our own spaces. And so It's the struggle, in my opinion, unfortunately, and it's unfortunate that it is a struggle, but it's the struggle that binds us. But we also have different cultural outlooks and perspectives that we need to respect. But in the end, we all are looking towards a common goal, and that's being more, having more equality, being more equitable, and things like that. And so you can bring the solidarity in on that point. Yes, you're different. Yes, we see each other as different, but I don't want to. But white supremacy harms all of us because of the fact that we look different and we are still considered among black and brown populations and we have different health outcomes. But when it comes to addressing those, that's when the approach gets different. That's when you have to tailor certain materials, certain talks, because you don't want to just look at them, oh, he's black. Well, yes, but he or she or whoever they, however they identify, are more than that. They may be Somali, they may have certain cultural, religious aspects, and that is okay. That is to be seen and respected as well. So that's how I kind of look at the grand intersection. It is a grand intersection of all these things, but there's a common goal of ending up trying to be equitable and trying to gain more power. And I'm not saying this, and to overcome, I don't want yes, let's say it, overcome white supremacy to a point where it's not toxic and it's harming us. And so that is how I stay focused, by seeing them as the same but different, but we all have common goals. And you can see that in a lot of different communities. I see it with the people that I work with different organizations. They just have a different outlook, and that's fine. In the end, they still want better quality care. They want to be heard. They want to have more leaders in higher positions of power to help them make decisions. And so that's how I kind of look at it. You once gave us a quote where, this is when it goes outside of the community, but you once gave us a quote where you said something about it's not the oppression Olympics, and that resonated with me. And so that's how I kind of look at it. It's not the oppression Olympics. We all have a struggle, and we have to center whatever we are focusing on, or whoever we are focusing on at that time.
Yeah, I think those are all very salient points. And I think the best example I have of how um, our diaspora is so vast, but we're often just minimalized. I think Dante said it just right. We're not a monolith. When I spoke to one of my African immigrant uh, friends, she's Somali. And she talked about her experience after she immigrated here to the States. And they were discussing, of course, during Black History Month, or the one time they discussed Black people in a history class. And of course, everybody turned to her to look at her to be the one to kind of explain the Black experience. And it's not her family's lived experience. Like they aren't descendants of slaves. They don't have that experience. They don't have those conversations at the table. They have a refugee experience, which is something that is very important to understand. But again, we have to tie in all these concepts, or it keeps being repetitive when we talk about a lived experience. But yet, when you engage with the health system, we unfortunately have minimized people to a phenotype, how they look to us physically when they present themselves. And unfortunately, that's what has happened with white supremacy, is that when you show up, you're still looked at as just a Black person. So when we have these conversations around health inequity or distrust of the healthcare system, people automatically go to, oh, the Tuskegee experiment and syphilis, and that's why they may not be taking their medications because they don't trust us. But yet you're talking about a Somali immigrant family who has no idea about the Tuskegee experiment. And that's not their family's lived experience. Whereas my dad, who's from Louisiana, born and raised, and was a sharecropper picking cotton, like my family's lived experience as descendants of slaves are very different. And so you have to then be able to understand, and this is something that I always find interesting, what is the conversations we have as a people amongst ourselves versus what's the conversation you have in, mixed company. And I think that mixed company conversation is always so hard, because when you try and explain this very delicate but very rich and beautiful, fabric quilt work of what is Black in America, you're going to have to recognize that there are going to be so many different ways in which people are showing up to be Black in America. And that in and of itself is that beautiful struggle, because you have to throw in there that what was very eye-opening to me is when I went away to college to an HBCU, feeling like the lived experience of Black people were just like mine, a single parent household, mother who became fell victim to the crack cocaine epidemic when it hit California. Everyone in my neighborhood, no one was college educated. But I go down to an HBCU and now I experience where the vast majority of Black people I come across, their legacy, their grandparents were at HBCUs. They're all educated. They're from a completely different socioeconomic status. But when we show up to the world around us, we're both just Black. And so then you have the conversation around, how are they engaging with the world that may be different than me, about what is their mistrust of the police when their family members have been police chiefs and detectives. And so for them, it's not the adversarial relationship like those who grew up in my impoverished neighborhood where the police terrorized us, right? And so this is what we're talking about when we say a lived experience and we're not a monolith, is that we're not all going to show up the same. But unfortunately, no matter what, whenever we are presented to any of these institutions, we're all just a Black person. And so that's where this gets very complicated, right? But at the same time, it still boils down to, no matter what, people just see us as Black. They don't see me as a surgeon. When I walk out into the world with my nappy hair, I am just a Black woman. When I show up, and if I'm a DOA if I'm a DOE at DOE, if I show up in the hospital and I don't have ID on me, they don't know I'm a surgeon or a physician. So what are the chances that I'm going to get care that is equitable? We already know the data. It's not good. Not unless they then somehow see my ID and say, oh, she's one of us. She's a surgeon. We need to take care of her. And that is where the problem lies, is that we should be, and the expectation should be, just like any of our white counterparts, any Black person that shows up to these institutions should be treated the same way as any white person who shows up into these institutions. But we just know it's not going to happen.
Yeah.
And so that's what we need to address.
Yeah, that was what I just wanted to comment when she made the talk about mixed company. I felt that because lived experiences, we always have to walk that fine line or attempt to change ourselves in certain situations. And it's not something that I believe that white people have to do when they engage. They engage with the world differently. And everywhere we go, we're Black. Amongst our internal community, we recognize the diversity and the differences. But outside, they do not. They, like she said, they just see us as Black. When I've been told, oh, that's a good school for you, what does that mean? Or that's you got, oh, congratulations, for you, like, okay, I'm still Black, and it's not just in care, it could be in other avenues and other environments as well. It's just that we just happen to be talking about care. But I just wanted to say I appreciate that point she made about the mixed company and stuff. That's so real.
Thank you both. So it is the mixed company situation and the dynamics of power in our society that leads us to exploring this concept of solidarity, right? Because of so many experiences that underrepresented, minoritized people have with healthcare, with health research, that says you're not one of us, so we're not going to take care of you in the same way that we would one of us. So just to bring it home to this program, this public art and community dialogue program that we have launched, that in this moment has this focus on how do we at Fred Hutch express our commitment and solidarity with the Black community in pursuit of our mission. What do you think is the promise or opportunity or something you look forward to that this program could take forward for us in that effort? Is my question clear? What do you think is the promise? What do you think is the promise of this public art and community dialogue program in driving meaningful solidarity forward with the Black community?
Yeah, thanks, Dante. I'm always very, I'm guarded anytime these things happen. And the reason being is that sometimes it can feel very, it's almost like I'm going to make the joke, I'm sure we all look at beans when people talk about, Joe Biden, and there were some policies that were, presented recently, and people say, we just asked for our loans to be forgiven. Like we can put these things out there. We can put out public art. We can put out that. But when we're asking for equal healthcare system, you have to recognize, like, people are going to say, yeah, it's nice that we have art in an institution that recognizes the Black experience, but I'm asking for equal healthcare. How does this translate to equal healthcare? And I think that's the hard part, right? Because we're trying to use representation, we're trying to use visual representation, we're trying to use these different avenues in order to change cultures and systems, and they all play their part. But you have to ask a question then: what does this do for the actual bottom line? And so I am I'm never going to turn down an opportunity to say that we are investing in our community. We're uplifting artists to put them in a public space that they otherwise may not have that opportunity. We're bringing economic investment to artwork, which we know is something that people it can educate and inform so many different people by the way art kind of presents and can help change narratives or invoke conversation and dialogue. And all of those things are good. And how are we going to address healthcare inequity? So I think that all of this is important. One should not circumvent the other, meaning you don't just say, well, we're only going to be doing anything once we know that it's going to actually change healthcare inequity, because we know this is a lifetime struggle. It took us 500 years to get here. We're not going nowhere no time soon with this struggle, right? It's going to be, we're in it for the long haul. And so as long as we're not losing focus on our vision by using these, we can sometimes feel very like face value, but not actually having real depth or any real content that is going to help change the material conditions of our people, that is where we need to have people at the helm, like a Paul Buckley, like a Dante Moorhead, making sure we're asking the right questions, that when you're in these spaces, we're saying, yes, this is good. And what else are we doing? How else are we pushing this narrative? How else are we going to change the material conditions of our people?
Those are very salient points, and I agree 100%. And part of me is biased because I'm part of the program, but I've had those conversations in meetings and Paul, and I think that we at least have to. And it's hard to picture. It's like health equity. We have all these issues, but Hutch, we did some art. That's hard. And it's it leads to certain skepticisms. But what I would say is that I agree with you. I would say that if done right, it could be a first step in what should be many, many more. And I know that's hard to envision, but it could be the beginning or maybe a transition into a new form of, more community partnerships. For example, we are transitioning, or we will become, Fred Hutch Cancer Center. And as we get that set up, a project like this, it can allow us to establish, a better presence, well, welcome or not, in the community, but it will show, more underrepresented communities that we are willing to seed important spaces and platforms. And this project can be even more effective if we make it a trend. Don't let it be a blip on the radar, but don't let it be, oh, remember we did the art thing that one year? No, we should sustain it, and we should be making authentic, and the key word is authentic, efforts to really connect and invite these voices into our space with an open mind. And this is a project, but I look at it as a unique opportunity. And the fact that we have even started to form these partnerships for the selection committees, establish external dialogue, it shows that we value these voices, and valuing those external voices is something, that I learned from my own office. And, it's an important and proven method. But I will say, and caution, in going off what you said, I don't want this to also be sort of a branding moment for Fred Hutch Cancer Center. Like, oh, we did this thing. See, we care. These are, we care, et cetera, et cetera. I don't want it to be necessarily like, a PR stunt. And I'm not saying that it is, but we don't want it to be an opportunity to brand. We really want to, if Fred Hutch is that, some communities have a view of Fred Hutch as sort of like an ivory tower. And if we want to kind of erase that, then we should be willing to use our platform to really dig in to the Black experience and other communities' experience, and not volunteer, but share or see this platform to those voices, because it could lead to bigger things. You know what I'm saying? And so just so we're not, doing, like I said, the PR stunt. We don't want to be like, well, you made this beautiful art, but can we put the logo here? No, we don't want to do that. We want to have a large platform, and we want to show that we are putting our weight behind these things. And if we truly care about these things that we say we care about, then we recognize the sentiment of anti-blackness racism that exists. And then we can respect the people by respecting their art, their expressions, their talents, what they bring to the table, and seeding and creating that space for them. And we make sure we don't just put it on some random building that doesn't get a lot of traffic. Let people know that Fred Hutch Cancer Center, stands for, or that we are behind it. And if we are really serious about initiatives like this, then number one, we should be looking at creating more initiatives and more things like this. And then we should also be willing to just talk brass tacks. We should be willing to fund it. That expresses commitment. It expresses a long-term commitment. We need to have funding every cycle for whatever, how many years, however we plan on doing this. I mean, from my understanding, it doesn't cost that much in the grand scheme of things. So we can make this happen, and we have a blueprint now for how to do it. And so the only thing that is missing is that we need to commit and build upon the momentum that we're trying to create and continue to let these communities and individuals into our spaces. And then that's how you build that trust. And then we can work on other things, while we're doing that, because both things can be true. We can multitask. My mom used to say you can walk and chew gum at the same time. And so that is something that we can do. While we are doing that, we are creating more opportunities, feeding platforms, inviting more people into our space, sharing our space. And then we are learning more and more about how to address these issues in health equity and care. And so that is kind of what I'm hoping that we can do, and it can be sustainable. It needs to be authentic. It needs to be funded long term, and it needs to be, we need to commit. It needs to be sustainable.
Thank you both very much. And just want to reinforce, this is not a branding stunt. This is not, an empty project. It is a signifier of other work. It is a catalyst to engage with community. And we hope that it will be, in many ways, a route for many other community engagement kinds of activities that will move our mission forward. And we see community as critical, our relationship with our surrounding community and the communities that make our community what it is. It's essential, it's critical for us to pursue our mission. So I'm not monitoring the chat, but I do have some wonderful colleagues who are, and I got this question. First, this compliment to you, Dr. Williams, says, thank you, I think it's to you. Thank you for being an amazing, in caps, Black queen. How can folks personally and professionally continue to push the wonderful work you are doing beyond being an ally and having conversations?
Yeah, I think that, thank you so much for that wonderful and kind comment. And I think that the way in which people, aside from just being an ally, is really when you are able and when you see that these programs exist, it's not just running off the fumes and the work of, oftentimes Black women, Black men, and our free labor, but really how do you then make that investment, right? This idea that there is a nonprofit industrial complex that, sometimes shuts out the organizations, the small people that don't necessarily get a lot of the investment that bigger organizations do. It does create a funnel, a bottleneck that then prevents our growth, our ability to invest in our communities, and really see ourselves flourish and grow in ways that could be helpful. So really, we recognize that we need investment, right? That's one of the things that oftentimes stifles our growth is our lack of investment that you'll see happen for other institutions that have less productivity and less outcome. So I think that you have to look at ways in which you can invest in order to sustain programming. And I think outside of that, it's really in medicine, and Dr. Buckley can appreciate this, it's being a sponsor. And sometimes sponsorship isn't in a monetary way, but really speaking up in spaces that these programs aren't present in. How are you speaking up? And how are you sort of advancing a person's cause when they're not even in the room to hear it? But just because you believe in it and you know that it should be something that other people know about and invest in, that's going beyond just being grateful that it's there, but really trying to ensure that it's sustained. Is speaking it up when you're in spaces, when you carry privileges, when you're in spaces that you recognize other people aren't afforded the opportunity to be. What are you doing with uplifting those names, those voices, and ensuring other people have the opportunity to know good works? And so use your voice to be able to kind of push forward and advocate for other entities that may not have the opportunity or be well known enough to be spoken up into some of these bigger places and spaces.
That's great. On that point, that made me think about, there's a recent program yesterday. We had Science Says featuring Trevor Noah, and Dr. Rachel Isaka was in conversation with him and Dr. Michelle. Oh my gosh, I just forgot Michelle's last name. Dr.
Andrasic.
Andrasic. Thank you very much.
I'm gonna tell her.
Well, there's the recording here.
I know.
But wonderful conversation. But the thing that I want to highlight from that was the initial conversation that kind of led to yesterday's program, where Dr. Isaka basically called Trevor in to doing just that, to being a sponsor, right? In a world where I don't think Dr. Isaka or any of us have access to that world currently, right? For her to ask him to have conversations with his friends and ask them questions around their colon cancer screening, right? And so all of us, I think, need to be able to recognize how we can be sponsors in our own networks around information around healthcare broadly and accessing the highest quality of care, right? And specifically as it relates to the work of Fred Hutch, cancer research and care awareness, and being an empowered person to demand the highest quality of care that each of us deserves. So I love this question. What is there about the process of making art, how it helps us to make sense of what happens in the world, that could improve the process of achieving healthcare equity at the Hutch, of improving those material conditions? I love this question. This person is tuned into why we are doing this project. Your thoughts, please, Dante and Estelle.
Yeah, I love this question too. I just think for one, it is people can, again, shout out to my mom. She used to say, I can show you better, I can tell you. And so it is a visual representation of everything that, there's a struggle for, you know what I'm saying? And that is reflected in the art. And I think that that's important because I'm all about, for example, shock and awe and shock value. You don't understand it until you can see it. It's in your face and you understand it. And something about the work and the pain and the beauty and the struggle all rolled into one that you can see that is expressed in this piece of art. It really puts things in perspective. Like visually, we know. Like I want to go back for a second to the pandemic and the whole Black Lives Matter movement. Like when everybody was at home because we were in a pandemic. So it had no choice but to be in your face. But you saw a man get murdered after having somebody on his neck for 9. You saw that, as painful as it was. You saw that and you understood. And the rest of the world saw that and they understood. I'm not saying all art has to be painted or that was art, because it was not. But what I'm saying is that visually, when you can see things like that, that's where it comes from. So when we have artists reflecting these things in their art and things like that, the struggles of health equity, somebody losing a relative to cancer, or it's not being treated fairly, dealing with implicit bias, whatever comes out in the art, that is very powerful. And I would say that everything should be reflected in this art. It's important to reflect and express the gifts, the talents, the pains, the struggles, the success, all wrapped up into one, put on the canvas, spread across a building or wherever, so you can see it and it's in your face and it doesn't go anywhere. And so it's something about that. And we all know that art can be therapeutic. I'm married to an artist and she does great work. No, I'm not entering her into this, although she pushed me about it. I said it'd be a conflict of interest. But anyway, it's just, we want, as a community, we want to be seen, and we want to really be seen. And so what better way of having you see us than creating something visual? Because not everybody's going to go out and read a paper or publish a paper, as brilliant as these papers are. Nobody's going to do the research, look at the tables and graphs and charts. Nobody's going to look at the data tables. What's important is the story behind the data. I can tell you about the disparities when it comes to, for example, African American women and African women in breast cancer. But what's more powerful is if I bring somebody to tell you their story, again, that lived experience, or for somebody to create something from their lived experience that lets you see. And to me, that is more powerful than me publishing a paper, putting it out on JAMA, and then walking away from it and nothing happens. But if you make art or you make something beautiful like that, people walk by it every day. Somebody's going to see it. Somebody's going to understand it. Somebody's going to empathize with it. And that can lead to transformative change. At least that's my pie in the sky version of it. So I love that question. Art is very therapeutic, and to express our pain but flip it into something that's beautiful is what really resonates with me.
Thank you, Dante.
Mm-hmm.
I couldn't have said it better myself. And I would just add, like, when you even think about it from a cultural, our indigenous roots, like, how do we pass down information, stories, histories? Yes, we're orators and we tell stories, but a lot of this was created in our artwork, in the way we wove baskets, in the way we created art with our hair, in the way in which, like, so much is through this sort of visual expression. And I couldn't say it better, Dante. It's the way we do things, right? This is the way we communicate with each other, is through that visual representation, through art. So it tells stories, it holds memories, it shares pain, it creates joy, it creates all the cadre of emotions that will kind of embed in us and really, allow us to continue to explore and share and change. And it carries so much power with it. And so, we say life imitates art, or art imitates life, but both of those exist for a reason, because no matter what, art is in there, right? And it is happening at the same time.
Such a wonderful conversation. Thank you both so much. Art, I think what's powerful about art is it's creative. I think we say creative and people don't understand the power of that word, but the power to create is an amazing thing, right? And I think in many ways, minoritized people, oppressed people are really demanding the right to create their lives in the way that they wish to create them, unhindered and with support from our human neighbors, just to live, to live and create the lives that we have with dignity. So this has been such a rich conversation, and thank you all for joining us today. Again, this is the first of many conversations we will have over the next couple of years and beyond, but this program itself will take a couple of years. I want to offer a special thank you to our ASL interpreters, Dave and Karen, who's on screen right now with me. And I invite all of you to look out for more information and news about our forthcoming conversations, our dialogues in April and May. And ultimately, the reveal of the new art message of solidarity that is authentic from Fred Hutch to our Black community and the entire region and the world that will be released on Juneteenth. Thank you very much. On behalf of the Office of Diversity, Equity, and Inclusion, have a great rest of the day.